system so that images can flow throughout the region. And that opens up real potential for us in securing access to expert advice on a 24/7 basis. We want to develop a 5 to 7 year cross-government strategy. I can't overemphasize really the importance of getting the political support and ministerial support to this agenda, and we have it in Northern Ireland across 3 different departments. The Department of Health, our economy minister is fully behind this, and also the Minister of Responsibility for our universities. So we have 3 different departments, 3 different ministers espousing the promotion of connected health strategies. There's been a lot of discussion about the electronic healthcare record. We have plans to move towards that, and we're working on that at this moment in time. We hope to be able to start piloting an initiative in that area towards the end of this year. And finally, we have a major procurement exercise planned where we would be commissioning remote telemonitoring services for 5,000 people by the end of 2011, hopefully starting early next year and moving up to that 5,000 figure at a rate which is compatible with the capacity of the suppliers of the service and for the system to deal with it. Just in terms of what we're doing at the moment, and some of these numbers are small, but this has happened in a very short period of time and is demonstrable of a momentum which is building in Northern Ireland with these new approaches. We have 500 patients at this moment in time whose implantable devices are being remotely monitored, cardiac devices are being remotely monitored by our cardiac centre in Belfast. We have probably the Royal Victoria Hospital for Sick Children in Belfast is certainly one of the leading institutions in the UK for developing telecare approaches to children with heart disease. We have a remote diagnosis service where the regional centre is connected to our other hospitals, a number of our other hospitals in Belfast. We have 100 children here who are being monitored at home through video links with the centre, and we have plans really to extend that to other disease areas. And we have about 170 patients at this moment on the traditional areas of chronic disease, diabetes, heart failure, and COPD. All of those numbers will be increasing. We've 3,000. We aim to have 3,000 patients by 2010 and 5,000 patients by 2011. Proportionately, just to give you a scale of this, in UK terms, you would multiply those figures by 30. So you're talking about the equivalent proportionately of 150 patients, 150,000 patients in remote monitoring in UK terms by 2011. The remote monitoring project is for us a flagship scheme, but it's only a start. We really do want to push this agenda quite hard. We will be developing a strategy for connected health really in the latter part of this year, which will say where do we go from here. Some of those initiatives, teleneurology, we already have a scheme in place where our neurological centre in Belfast is carrying out remote neurological assessments at one of our local hospitals some 80 miles away in the west of the province, and conducting outpatient sessions over remote links. We want to explore the potential for putting telemonitoring links into our nursing homes, really to see whether that would help reduce the number of hospital admissions from that source. And we want to look at the extent to which we can develop remote monitoring systems for palliative care or cancer. I've already mentioned the electronic care record. What's not here are the initiatives in social care. where we actually provide and are responsible for hospital and social care services. So the whole telecare initiatives will also come into our plans to be developed in the course of the next year. So this is really about our flagship telemonitoring scheme. The aim is to have 5,000 people on remote monitoring by 2011. We recognize that technology is not the constraining factor here at all, but it's the ability of the system to respond to that. So we're building that capacity right at this stage. We're engaged in a series of workshops, working with our clinicians, addressing their concerns in order really to prepare the way for the scale application of these new approaches towards the end of the year. We're on the cusp here of announcing the formal procurement. Later this month, probably next week, we'll be putting a prior indicative notice into the OJU to say that our intention is to initiate a procurement exercise, and hopefully then that will allow us to engage with suppliers so that we're informed by their views, and in the service that we specify in our procurement, that our aspirations are, if you like, tempered by the ability of the industry to respond. And then during the summer, we will be going to a full procurement exercise under our EU regulations. So in terms of then the European Centre itself, we're driving the remote monitoring project. That's the right-hand side of the triangle in terms of the strategic design of systems of care. We're working with our clinicians in terms of the detailed patient pathway that would apply. And we think all of this activity has to be rooted in the health and social care system. But from that, we think there are issues where we can branch out and provide a lead in the application of this type of technology, potentially throughout Europe. But also we can do this in a way which promotes economic activity. Left to its own devices, I think the health and social care system is very, very good at identifying small-scale projects, which are of benefit to small numbers of people and reflect the enthusiasm of the individual clinicians. I call that the 1,000 flowers blooming approach, which is good, and we shouldn't stop that. But I think if we really want to get to a position where we can have an impact at the population level, we need to have systems in place which allow us to prioritize and focus on the regional application of these technologies. So we will have a role there, and we think when we do that and go to scale, that will in fact help with economic activity as the market responds to those needs. So, okay. Yeah, so final, really closing, where we want to get to, I think there's a real opportunity here for Northern Ireland to become an exemplar population, where our experiences then can be examined and may well help address this agenda on a European context. We have, I say we have a cross-government approach. We have a population of 1.7 million people. We have 5 organisations delivering health and social care in Northern Ireland. So there is a very small chain of command from policy through to application. So we can do things very, very quickly. We have had a track record of significant transformational change in very short timescales. So, and that's backed up with a huge track record of innovation by some of our smaller companies and by our universities. And if you look at our history, where we have emerged from a troubled past over the last 30 years, we've put that behind us, and we now want to step forward and really play our role at an international level and contribute to an agenda which all, I think, health and social care economies across Europe is struggling with. So thank you very much indeed.